Be advised, the opinions and views of the hosts and guests do not reflect those of the station.
Good evening, ladies and gentlemen, and welcome once again to For the Public Good. We're the program that tries to identify corporations, institutions, and individuals who are doing good and doing it well. And my co-host is here again with us this evening, Vincy Beltran, and she's going to introduce tonight's guests.
Good evening. Our guest this evening is Dr. Christian Emmanuel V. Mancao. He's an MD with a degree from the University of Santo Tomas. He's medical director of the Mancao Myotherapy Center, where he relieves patients of chronic pain. He uses a method he started developing as a volunteer physician during Desert Storm in the First Gulf War. His method is called myofascial release and is also known as immediate relief myotherapy. Most important, relief comes within 15 to 30 seconds manipulation, depending on whether manipulation was of the upper body or lower body. Dr. Mancao, thank you for being here this evening.
Yes, Vincy.
You're not going to say that, I guess. Okay. I had put something in there. She was going to talk about old guys. But hey, welcome, Dr. Chris. and I'm really happy because we do have a younger person and an older person here tonight to talk about something that all of us face in life, and some people have chronic pain all the time. And I would like to get started by having you talk a little bit about how you got started in this. And I understand it started with what you were doing during the First Gulf War. So can you tell me how you got started in pain relief?
Yeah, my basic working background has always been in surgery. And during the Gulf War, we had a lot of time to wait for the casualties of war to come because the ground war was not yet there. We were there a month before. So I was looking for a method by which you can instantly remove pain with nothing. And yeah, we found that technique, and it's a very, very appropriate one because it takes only 15 seconds to remove pain.
But you didn't discover how to do this in 15 seconds, obviously.
No.
How long did it take you
It took me about 5 years to perfect it,
see.
Especially for the lower manipulation, because the second cause of absenteeism in workplace is low back pain.
Right.
And low back pain is the most difficult. Some will have back pain for years. But in our clinic, it's only 60 seconds to remove back pain, no MRIs, no x-rays, no lab tests. And it's nice because you see them stand and jump and reach the floor, bend and reach the floor in just one treatment.
Where were you when my father was suffering his whole life? Gosh, that's... And that's one of the things that I've always heard, that people say, well, my back hurts, but nobody can see anything on an x-ray or an MRI or anything like that. They can't really see where the problem is. How do you see that, I guess is the word I'd like
Well,
to
you will notice the funny posture the patients have when they're paralumbars. The muscles, the lumbar area are totally locked. And when they sit, their back is no more curvature. It's really flat. So this is nice because it only takes sometimes even 15 seconds to bring back the curvature.
And the basis of all of this is not bone structure, but muscles? Or
Muscle. Remember, the largest organ of the human body is not skin. Skin is the largest integumentary organ, but the largest organ of the human body is skeletal muscle. 40 to 60% of your total body weight
is muscle.
Yeah, skin is only 9 pounds in weight.
Yes, so you said you cure chronic pain. In layman's term, what is chronic pain?
Chronic pains are pains that last more than 3 or 6 months. Up to now, they have not decided whether it's 3 or 6 months, but that's the definition.
Okay.
It's just as chaotic as the concept of muscle. You know, we know how many bones there are. There are 206 bones. The problem is we don't know how many muscles there are. We already know what the components of DNA is, but up to this day, they are still fighting over how many muscles there are. Is it 400, 500, 600, or 800?
That's a big difference.
Big. You open the internet, you get confused.
Really? And who when you're learning to be a doctor and you're studying, what do you learn about muscles?
Well, we just know the muscles from anatomy, but the technique of looking for chronic pain and how to evaluate chronic pain syndromes and removing pain, that's a different thing, because all of us in practice are drug pushers.
Mm.
We keep on pushing and pushing drugs, and most of the times it works for acute pain, but for chronic pain doesn't work at all.
Right, right.
That's why the patient keeps on going around from hospital to hospital, alternative practice, and whatever.
And so your particular method doesn't depend on drugs.
No, we are not. We are drug-free. Because migraines is just 1 second to remove, and it's 100%. Every time we see somebody with severe migraine, you just have a 1 second intervention, then the migraine is gone.
Really?
It's that fast.
Your treatment, it offers long-term relief?
Yes. That's the nice thing about it. The relief is the remissions, the period of remission is much, much longer. As a matter of fact, sometimes after 8 or 9 years, the patient is still pain-free.
So, maybe just as a question, I know nothing about what is the basis, the physiological basis of your therapy? Are you twisting, pushing, pulling?
That's nice. We're just bringing it back to its original length, the muscle, because most of the time, mainly because of the way we react to the pressures of life, we're always under stress, and our muscles are always in fight or flight mode. You see that in the faces of a lot of people. They're always like this. Now, if your muscles are in fight or flight mode, remember that most of the blood vessels are inside muscles. So your blood pressure starts to go up and up. And of course, we doctors keep on giving drugs and drugs and drugs to relax what do you call this, blood vessel, not knowing that it's the muscles that are actually squeezing the blood vessels. If you just relax the muscles, then boom, the blood pressure goes down. That's the better approach for bringing down blood pressure.
And you relax the muscles through some sort of manipulation of the muscle
but
itself.
This kind of a manipulation is unique because it is by reflex. Meaning to say a 15-second intervention can make all your muscles of your whole body can relax immediately. Isn't that strange?
I mean, no, I'm astounded, of course, you know. And where in most of the people that come for therapy, where do you find the place to start with them? Does it usually start with the neck and the shoulders? Does it start with the hips? Does it start with what?
Most of our population is more than 30 years old. They suffer from multiple areas of chronic muscle locking state, from neck pain, shoulder pain, back pain. Some of them are full-blown cases of fibromyalgia, and fibromyalgia is catastrophic because it's called pain everywhere syndrome. It affects your sleep, it shatters your memory, you become dysfunctional, and of course in America they say you cannot find a cure for it. That's why they keep on giving them antidepressants. But here, no, you don't need that. Just give a 15-second manipulation, then they transform. We call it the Jekyll and Hyde transformation, from the monster of Mr. Hyde to the handsome Dr. Jekyll, instantly in 15 seconds.
Who are your youngest clients?
Oh, we also treat children with bronchial asthma. Maybe about even 2 years old. My oldest patient is 105 years old.
Wow.
And you know what she did? After the manipulation, she held my hand and said, "Doctor, one more time."
Well, I've already, you know, I tell all my friends, look, I'm only going to last for 105 years. After that, I don't really care anymore. So maybe I'll come by and see you about that time. We'll, so as people get older, of course, they complain. You know, people that are generally, maybe they don't get enough exercise throughout their whole lives, and so they're really kind of crotchety by the time they're 60 years old or whatever. What do you do with those kind of patients? Do you treat them, but then do you try to get them to change their lifestyle or to get more exercise, or do you have regimes